All right, picture this. You've invested the time, the money, and honestly, a bit of mild discomfort into getting that absolutely flawless, brilliant smile. Your teeth are perfect. But then, disaster strikes. Welcome to today's Explainer, where we're going to break down the science and the solutions behind exactly what happens when your perfect smile chips.
It always happens at literally the worst possible time, doesn't it? You're just sitting there enjoying dinner, maybe biting into a crusty piece of bread, or even doing something as mundane as brushing your teeth before bed, and then you feel it. That unmistakable, terrifying sensation of a rough edge where there used to be perfectly smooth porcelain.
Suddenly there's a gap, and you've got a small, hard piece of something resting in your mouth. Boom! Panic instantly sets in. It is a wildly high-stress moment. But hey, take a deep breath. Today we're going to look at the clinical reality behind this, because the good news is that a chipped veneer, or even one that falls off completely, is a thoroughly known and understood complication in restorative dentistry. There are clear, professional ways to manage it.
The absolutely crucial point to remember here is that while veneers are designed to be incredibly durable, they are not indestructible. Whether they're made from porcelain or composite resin, they're attached to your natural teeth using adhesive bonding techniques. They're built to handle a lot of daily pressure, for sure, but they aren't magical force fields. If one fails, it's not necessarily a personal failure on your part. It's simply the reality of dental restorations facing the daily grind.
Section 1. The culprits. Why veneers actually fail.
To really understand why a veneer gives out, we have to look at both mechanical and biological forces. We can kind of divide these culprits into two distinct camps. On one hand, you have your sudden mechanical trauma. That's an accidental impact to the mouth or biting into a really hard almond. But on the other hand, we have the slow, silent saboteurs. We're talking natural wear over time, a gradual dental adhesive failure where the cement actually loosens, shifts in your bite alignment, or even underlying tooth decay sneaking up beneath the veneer. It really is a battle between a sudden snap and a slow, gradual detachment.
And speaking of silent saboteurs, we absolutely have to talk about bruxism. This is the habit of unconsciously grinding or clenching your teeth. It causes massive occlusal stress. Basically, that means immense sustained bite pressure. If you're a grinder, you are subjecting those veneers to forces they weren't strictly meant to endure around the clock. This drastically affects their longevity, and honestly, it's a huge driver behind sudden fractures or bonding failures.
But here is a reassuring fact for you. Failure isn't always a sudden, out-of-the-blue surprise. There are almost always warning signs. If you notice a tiny bit of looseness, or maybe visible hairline cracks, sharp edges, a sudden spike in sensitivity, gum irritation, or even some discoloration at the margins of the tooth, pay really close attention. These symptoms can point to early adhesive breakdown, or what clinicians actually call marginal leakage. Catching those warning signs early can save you from a much bigger headache down the line.
Moving right along to Section 2, Assessing the Damage. Chip versus full detachment. So there is a massive clinical difference between a chip and a full detachment, and knowing that difference completely dictates what happens next. A minor chip is usually caused by direct bite pressure. The fix? Actually quite simple. A clinician can often just do a visual exam and manage it right then and there with a quick composite repair or by smoothing it out. But a full detachment? That happens when the actual bond fails, not necessarily the veneer breaking. When a veneer fully pops off, it leaves your underlying enamel and dentine totally exposed. That means your tooth is suddenly extremely vulnerable to temperature changes, and you're going to need a clinical exam, imaging, and either professional rebonding or a total replacement.
Section 3. Emergency triage. Your immediate next steps.
All right, so it happened. The piece is out. What now? I want you to treat this like a clinical first aid checklist. First up, keep the veneer intact. Do not throw it away. If it's not structurally cracked, a dentist might actually be able to just reattach it. Second, avoid chewing on that affected side to protect whatever tooth structure is exposed. Third, maintain gentle oral hygiene. Keep the area clean, but whatever you do, don't scrub it aggressively. And finally, arrange a prompt dental assessment. This little first aid response is absolutely crucial for protecting the prepared tooth and drastically reducing your risk of intense sensitivity.
Now, I know exactly what some of you are thinking in a moment of panic. Hey, I have superglue in the utility drawer? No, absolutely not. Attempting to glue it back yourself is highly, highly not recommended. Seriously, DIY dentistry is just a terrible idea. Dental bonding material is incredibly specialized, and the tooth requires very specific, sterile prep to ensure safe reattachment without trapping decay-causing bacteria. So please, step away from the craft supplies.
Section 4, the fix. Let's talk about professional repair options.
Let's look at the long-term professional solutions. Drawing on the clinical approach outlined by the experts at the Caring Dentists, there are a few things you absolutely need to know about restorations. First, longevity. Remember that while porcelain often outlasts composite resin, both are long-term, but not strictly permanent solutions. They might need replacing eventually. Second, sensitivity is a very real factor if your enamel is exposed, though it's usually temporary. And third, bite forces. Like we mentioned earlier, grinding drastically increases your risk of damage. So good oral hygiene and regular professional checkups, totally non-negotiable.
When you finally get into that dentist's chair, what are they actually looking for? Because they're definitely not just staring at the broken piece of porcelain. They are evaluating specific clinical attributes to decide if a simple rebonding is going to work or if you need a full replacement. They're going to check for adequate enamel structure to actually bond to. They'll assess your bite alignment to see if a simple misalignment caused the break in the first place. They review your hygiene habits, look for any active decay or gum disease lurking beneath the surface, and thoroughly analyze those occlusal stress patterns. It's a really comprehensive assessment.
Which brings us to our final thought for this explainer. Be honest, are your daily habits putting your veneers under hidden pressure? Whether it's crunching ice, biting your nails, or clenching your jaw during a stressful commute, your daily life literally writes the story of your dental health. Take a moment today to just be mindful of the physical forces you're applying to your smile. Understanding the mechanics of your own bite might just be the secret to keeping those perfect veneers pristine for decades to come. Keep learning, keep smiling, and we will catch you next time.